The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome back to another great day of Aging Horizons in Montana. Today we'll be talking about Cover Montana. There's a private sector organization out there that wants individuals to be covered with health insurance, whether it's Medicaid, Medicare, private insurance, special programs that are there, or through your employer. About 8 to 9% of Montanans aren't covered, and we want to help those people out, so stay tuned.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior Long-Term Care Division. I'm your host, Brian Lamore. As I mentioned earlier in the opening, that we have a private sector group that is concerned about Montanans being covered with health insurance. About 8 to 9% of our population do not have health insurance, and you can know how catastrophic that could be if you have major health issues. Well, joining us today is Olivia Riuta. You're the Director of Population with the Montana Primary Care Association Health, and you cover the Montana Project. You're the head of that, which is connecting Montanans to health insurance marketplace. Wow, quite the title.
It's a mouthful.
Yes, what we're coming down to is a special program you have is Cover Montana.
Yeah.
And what is Cover Montana? Why is that important for Montanans?
Yeah. So Cover Montana is a project that's really focused on connecting Montanans to health insurance coverage, right? Making sure that folks understand what they qualify for, helping folks fill out applications, and making sure that people don't just get health insurance, but they understand how to use it, right? Even if you've had, what we know is even if somebody's had health insurance their whole life, we could all use more information about how to best use it. We call that health insurance literacy. And so we, at the Primary Care Association, it's a project we've had for almost a decade. And Cover Montana, for most folks, you see our website. And we provide kind of information, but most of all, we provide help, right? We want to connect you to someone.
Yes.
And so there are kind of folks across the state who are trained and certified to help their neighbors and their communities enroll in coverage. And so they're going to be helping mostly with folks who are eligible for Medicaid, folks who are eligible for the health insurance marketplace, which is located at healthcare.gov, And really, everybody's different, but walking folks through that process. For some folks, it might just be, I have a question about the application, can you answer that question? But for some folks, it's, I want to sit down with you and I want to do the application together, kind of soup to nuts, and that might take a couple of hours. So everybody's different in terms of how much information and support they need, but our goal is to really make sure that Montanans have that, whether it's in person, over the phone, if people really want to prefer to do it over Zoom, kind of whatever works best for our friends and neighbors who need health insurance coverage.
With all the new technology, it's wonderful, but I think an important point to make here is you're not a health insurance company. You don't have anything on the shelf to sell. You don't push people to certain companies. Tell us more about that.
Yeah, so the folks that we work with are certified navigators or certified application counselors, and so part of our certification is that we don't sell health insurance. We're not allowed to, and I can't say to you, no, you should really pick this plan over this plan.
Right.
Our goal is to really give folks the information they need so that they can make the best decision for them and their family, and usually kind of what fits with their monthly budget. So it's healthcare needs and monthly budget. So we often talk to people. I like to say there's no obligation to buy. We often will talk to somebody, sit down, look at what their options might be, and they say, "Hey, it's not for me. I'm not interested. I'm not interested in enrolling." That's totally fine.
Yeah.
We want to make sure that person might change their mind. Their circumstances might change. They can always come back to us, but we're certainly not going to be selling insurance.
Right.
And also, our goal is to get folks information and support if they need it.
You want them to make an informed choice based on their situation. Well, earlier I mentioned that there's about 8 to 9% of Montanans that are not insured for health insurance. Well, why is that? Is there some contributing factors?
I think there's a lot of contributing factors, but what we hear most of all is that people can't afford it, right? We never sit down with people who are like, I just don't like the idea of health insurance. I don't want to have peace of mind, right? Everybody wants peace of mind, and everybody wants to know they're going to be covered if they have to go to a doctor, whether it's for a routine visit with a primary care provider or if it's an emergency, kind of in a hospital situation. And what we hear from folks is they want to be covered, and but they feel like they can't afford it, and so a lot of what we do is really focus on kind of what coverage options exist. And for the health insured, for some folks that's Medicaid, right? We're going to do one application, and that application will help folks land in the program that they qualify for. For some it's Medicaid, right? That's for low and moderate income folks. It's a kind of full health insurance coverage, and for some folks it's the health insurance marketplace, which is at healthcare.gov, and in Montana's marketplace you can buy plans from 3 private carriers, from Blue Cross Blue Shield, from Pacific Source, or from the Mountain Health Co-op. So on the marketplace you're buying one of those plans, but the key is affordability, right? And so the marketplace has some mechanisms in place so that folks can apply for and receive financial help to make sure that premium is more affordable and they can actually pay and afford that insurance.
So imagine the number of individuals, if they don't have insurance, they don't go to the doctor, and that's a big problem.
Yeah, we certainly want folks to be getting in to have a relationship with a primary care provider, to see their provider early, right? So you're catching things and you're not delaying care, because that's really bad for people and their health outcomes. And it unnecessarily wastes our healthcare dollars, right? Things we should be doing with our doctor in a clinic as opposed to showing up in the ER.
So a little pre-treatment and a little advice on how to have a healthy lifestyle, and maybe to change some habits, which they many times have programs to help you do that, so you can lead a long and healthy life in Montana and enjoy our environment here more. Now we've got a lot more great information. We'll be continuing in our next segment about the Cover Montana, how important it is for you to get insurance and how they are helping. So stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, welcome back to Aging Horizons. I'm your host Brian Lamore, and we're continuing our discussion about Cover Montana, a private sector organization which is working to get insurance for all Montanans. There's about 8 to 9% of the population that don't have insurance. And Olivia, you know, we're talking off camera about there's been some changes in federal laws which makes insurance more affordable. What are some of those?
Right. I think that's the first question we always get is about affordability.
Yeah.
And so last year there were some changes essentially to how much folks need to pay out of pocket toward their health insurance premium on the health insurance marketplace.
Right.
So, which is a big deal. So this is how it works. So if you're coming to me because you need to enroll in coverage, what we would do is sit down and fill out an application. If you and your family were eligible for Medicaid, right, we'd find out, and your application will be sent directly to Montana Medicaid. But if you're above income for Medicaid, depending on your income, depending on how many people are in your household, the healthcare.gov automatically determines if you qualify for tax credits. Those tax credits, right, aren't tax credits you have to wait to receive. They're tax credits that you're projecting your income and you're qualifying for those tax credits in the tax year that you're using them, right? So that folks can afford to pay their monthly premium, right? So the tax credit works. So this is the cost of your plan. Some of your tax credit gets sent to your insurance company, and you might pay the difference. So each month you're just paying that difference.
Great.
And so most Montanans qualify for tax credits. So most Montanans who are enrolled in the marketplace already qualify for tax credits, about 86%. So that's a lot. And then for some folks, depending on their income, there's also there's savings on out-of-pocket costs. So they might be able to get into a plan where it's more affordable to see a provider when they actually go and see a healthcare provider or receive services. It all depends on your family size and your income, but essentially the federal changes have just reduced the amount that folks have to pay out of pocket for premiums, which is a really big deal. And then for folks who are enrolled members of federally recognized tribes, there's some specific provisions in the marketplace, and many folks qualify for what we call a $0 plan. If they are below a certain income threshold, they can get a plan with little or no premium and then no out-of-pocket costs to actually see a provider. So a really big deal. We talked to a lot of folks who maybe they applied 5 years ago, right? They sat down with somebody 5 years ago and they found out and they thought, this isn't affordable for me. I can't make this fit into my monthly budget. Or I'm relatively healthy and I'm going to write, like, health insurance isn't at the top of my list.
Right.
And so we sit down with a lot of folks who maybe they've done that. We fill out an application with them, and then they qualify for more than they thought they would. Their out-of-pocket costs are more affordable than what they thought and what they saw before. But just the relief that you can see on somebody who kind of leaves your office knowing that if something happens, they have health insurance, that they can both go to that hospital and they can establish care with a provider, do all their preventative stuff, right? A big change with all these plans on the health insurance marketplace and kind of plans in general is that most plans cover preventive services, right?
Yeah.
So, which is a big deal, whether it is kind of an annual exam, whether it is a well child visit for a kid, whether it is kind of certain screenings as we get older. So we talk to a lot of folks who are just so surprised by what they qualify for, and they're so relieved to be able to kind of access healthcare.
To get some coverage. Now, you know, we use the term marketplace, and a lot of people that maybe they're coming off employment or whatever, and marketplace. What's a marketplace?
Right.
Where do I access that, and what does it do for me? Can you explain marketplace?
Yeah, so
insurance?
we call it the Health Insurance Marketplace, or healthcare.gov. That's the website. Some people call it Obamacare.
Oh, okay.
Right? But the idea is that it's a place where folks can shop for insurance. They can do kind of an apples to apples comparison. But they can also see what they qualify for. So you're not just looking at the kind of sticker price of a plan. You're able to see what kind of tax credit you qualify for. And so the sticker price is reduced. You can actually see, okay, well, can I afford this much out of pocket each month? And then we can do things like put in where folks access care. Do they have a primary care provider? Do they like to receive services at a certain hospital? Do they need certain prescription drugs? So that they are really shopping with their tax credit and they're looking at plans that really work to meet their healthcare needs. And so the idea is instead of that you have one place where you can shop for insurance, it's like the Amazon of health insurance shopping for Montanans. And so just to make it easier so that people have more information and are able to get through that process and really get connected to something that they qualify for.
Okay, and I imagine that an individual can shop policies. There are probably minimum ones, and there's more to bigger ones, depending on how much more you'd like to spend and what you're enabled to afford through the program.
Absolutely. I think it's like an open, every year our health needs change, right? And so it's really each year folks can reapply, reselect a plan, and folks often change their plans depending on what they're expecting, what they know is coming in the year ahead, what they think might be coming. And so really trying to match folks to the plan that really works for their budget and their health needs each year.
And you have a website that can help the individuals do that. Now, we're quickly drawn to a close on this segment already, but what's important here is that you have coverage, because when people don't have coverage, they don't seek health professionals, and issues get worse and worse. They usually don't get better. We got a lot more information. Stay tuned. We'll be right back.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals.
From the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy. Most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Cover Montana. It's a private sector program that helps individuals get insurance or evaluate insurance or understand insurance, anything insurance. They can help you out any age. Now, Olivia, let's start at the top. We have Cover Montana. It has a website, and there's a lot of great information there. What kind of help does that website give the individuals that go there?
Absolutely. So the website's covermt.org, and the website does a couple things. It provides some basic information. So if folks need a little bit of information, they're kind of starting this process, they can find some information there. We have a calculator. So we're talking about health insurance coverage options, and I often talk to people who say, well, that sounds nice. I'm not sure I want to meet with you yet. I'm not quite convinced. And so folks can, in like a minute, fill out a calculator to see what they might qualify for. And it asks just a couple simple questions to get a sense. What do I potentially qualify for Medicaid? Am I qualifying for a marketplace plan through Blue Cross or Pacific Source or the Health Co-op? And how much might I get in a tax credit, right? So that then folks can make a decision, do I want to move forward in this process? The website also really works to connect folks to somebody locally who they can ask questions of, and who can help them through that process. So you can put in your zip code and you can find folks. Maybe you want to talk to the person closest to you in your community. Maybe you don't want to talk to somebody in your community because sometimes tiny towns are tiny towns, right? And you want to talk to somebody in you want to call into Great Falls or Billings or someplace else. So you could put in a zip code and see folks who are trained and certified to help you through this process. There is, in a lot of communities, folks can do an in-person enrollment, right? Can literally sit down and do the application on the computer together and kind of talk through things. We find a lot of folks find it easier to do it on the phone, or they prefer to do it over Zoom. And so kind of whatever is most convenient and works for folks, we want to connect them to somebody locally who they kind of can help them through this process and provide as much or as little support as they need.
Right. Yeah, you'll make it work with the technology we have. Now, you're talking about certified individuals, and of course there are people that maybe not even Montanans, they're calling in and they're pressuring you to get their policy, and sometimes that ties into fraud. What can you tell us about that?
Well, what I would say is that if somebody is calling you over and over again, that would make me suspicious. I think that, so all the folks that we work with, right, an insurance agent or broker in Montana, a certified application counselor, a navigator, I would ask them for their name, I'd ask them for their license number, right? If anything made me feel nervous, I'd hang up and I would start over and say, maybe I want to have a conversation about coverage, but let me start with the organization in my community I feel most comfortable with. And so I would say if anything feels fishy, if there's any pressure, to pause and start over and just make sure you're starting with an organization and an individual you can trust and go from there. And I would say if there's not somebody in your local hospital, your local clinic, your local senior center is going to know who's certified to do this work. And so you can always say, hey, who can help me and get the referral that way. But if anybody is pressuring you, I would say put a pause on it, start over, and make sure that nobody should be pressured to enroll in coverage, right? And if they are, I would hang up the phone.
And don't give them your Social Security number.
Definitely don't give them your Social
Don't give them your
Security.
Medicare
No.
number.
Mm-mm.
Don't give them your bank account.
Nope.
And you initiate the call to a trusted source, which
Absolutely.
could well be the numbers we have on the screen. But now, there's also open enrollment periods and special periods for different programs. Tell us who's eligible and why do we have these periods?
So open enrollment period, so every insurance plan usually has a time, an annual time of the year where you can sign up or switch plans, right? So if you get coverage through your employer, it's often a different time each year. For the health insurance marketplace, open enrollment is going to start on November 1st, which is a little different than Medicare. So there's kind of two open enrollment periods that overlap. But if folks today are listening to this and thinking, geez, I'm not covered, do I qualify? We answer questions year-round, right? There are some circumstances where folks can enroll mid-year, right? And if somebody's eligible for Medicaid, you can enroll in Medicaid at any point throughout the year. Medicaid doesn't have an open enrollment period. But we're happy to have a conversation, and we could plan. We might fill out a calculator and say, okay, it looks like once open enrollment is here, does this sound like something you're interested in? We often set appointments months in advance in preparation for open enrollment. So if anybody has questions or is wondering, they can give us a call. We can talk through that process. And if they can't enroll now, we can certainly help them once they are able to enroll.
And what's important is that you're unbiased information, you know the programs, you can set a long-term plan for them, but they make the decisions.
Absolutely.
You don't sell anything.
Absolutely. It's all about giving people the information and support they need so they can only the individual knows what's best for them and their budget and their family. And so that's our goal, to really help support them in what they specifically need.
And they can initiate the call to you or go to your
Absolutely.
website.
Yeah.
They can get information. I mean, the insurance is a topic that we don't understand it. I mean, it's a professional language, and you help them out with that.
Absolutely.
That's great. Well, you've been a wonderful guest. Thank you so much
Thanks
for being
for
on the
having
show.
me.
So much great information here, and special thank you to the Montana Primary Care Association for allowing you to come here, employing you, and make sure these programs work. Great. And for our viewers, we've been talking about the Cover Montana program, which they want to make sure that all people are insured with health insurance. There's about 8 to 9% of Montanans that are not. And that can cause a lot of, I'll say, heartburn if you're worried about going to the doctor and what it can entail and what it might cost you. But they have some solutions. There are some programs out there that can help you. So thank you for joining us today on Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.